Okay, I'm doing carpal tunnel syndrome. My patient she is female. She is 28 years old and her name is Bianca. She has carpal tunnel in her right wrist. She is a receptionist at a hospital, which means that she is typing a lot, taking phone calls, using her mouse and keyboard a lot, which is a big cause of carpal tunnel. Um, she went and visited her primary doctor, and her primary doctor then um, referred her to a neurologist who performed a NCS and an EMG on her um, to show like the conduction in the median nerve and the normality of the activity in the muscles controlling the median nerve. Um, Carpal tunnel syndrome is basically caused by compression of the median nerve. Um, and yeah, the medical name is carpal tunnel syndrome. The common name is carpal tunnel. Not much of a difference. The risk factors are definitely what she does as a job, which is repetitive movements, as in using your fingers, your hand, your wrist, your arms, and typing, and using your mouse, which does cause carpal tunnel. It is also prolonged wrist flexion, and it can also be caused by diabetes, rheumatoid arthritis, and hypothyroidism. The prevention methods is definitely take breaks. If you're like a receptionist or anything, you definitely need to take breaks and maybe stretch out your wrists. And if you have any pain or if like the symptoms are very mild before they get worse, start wearing like wrist supports. So basically, carpal tunnel in your body is made up of bones and ligaments, and the median nerve basically goes through that, like it's inside of that tunnel. So what's happening in her body is basically her median nerve is being pressured so much that her median nerve is now inflamed and swelling, causing her pain and clumsiness. And she also mentioned that when she like sometimes she'll feel like her wrist is like asleep, as in if you like lay on one of your body parts for so long, it starts tingling and it feels like asleep, like you can't really move it that well. That's what is happening to her, which makes a lot of sense considering her carpal tunnel is putting pressure on her median nerve. The affected organs slash systems in this in carpal tunnel is your musculoskeletal system and your nervous system. And then symptoms Bianca has experienced are what I just said: the tingling, the clumsiness of like losing control, like since it's like, how do I put this? It's basically like weak, like really weak. And the population who usually have this type of syndrome is adults between the age of 25 and 50. It is more common in females, considering that more females are doing what she does, like being a receptionist, doing stuff like that. Yeah. So some of the medical treatments that you can use is number one, ibuprofen, which is basically just an over-the-counter pain medication. Like it reduces the pain and also it can reduce the swelling of the carpal tunnel. And then the second one is corticosteroid injections, which also reduces swelling in the carpal tunnel. And the most harsh medical treatment would be surgery if it really got that bad. Some therapeutic treatments would be wrist splinting, which keeps the wrist in a neutral position. Um, and another one would be physical therapy, which helps stretch out that wrist and helps grow more muscle, I guess you could say, especially if she is experiencing weakness in that wrist. Activity modifications, which would be changing wrist posture during work. So you could get like a wrist rest for your keyboard, so your wrist is resting instead of being in that flexion pose all the time. And in Bianca's case, she started using a wrist splint at night, which is also helping the inflammation in her wrist. She also began physical therapy, um, and yeah, this is my works cited. Yeah, that's that's it.